Our research at the center deals with understanding issues like how do we use information and communication technologies? How does it impact our work meetings, for example? Does it disrupt the work meetings for someone, for instance, to pick a device and interrupt the flow of the meeting? How do we use a personal health record? How do we use a website? How do older adults interact with an e-commerce website? Do they have special needs because of the physical or cognitive changing abilities as a natural consequence of their aging process? So a recent trend is the use of neuroscience and to collect physiological measures and neurological measures that give an objective assessment of the subject's experience as they're actually using the technology. And there are a lot of benefits to that. So first of all, as opposed to asking people post hoc about their experiences, say, for example, with using a certain software or website, we can actually observe them and collect data in real time that will give us more accurate reflection of their true experience in using that website, for instance. So at DTRC, we're tackling certain topics that may relate to healthcare and the activities of the Health Leadership Academy, for example. So for instance, we looked at the adoption of personal health records by both healthy subjects and chronic disease patients. And we looked at whether educational interventions could improve the adoption rates of diabetes patients for electronic personal health records. We also look at older adults and how they use e-commerce sites and how can we best support them so that they can overcome some of the cognitive biases they have while navigating or making these decisions. We also look at other applications like technostress, which is stress that is generated due to the use of technology and the user certainly experiences some stress, and that is documented. But the new idea here is to look at second-hand technostress, which is stress experienced due to the use of technology by people in the vicinity of other of users of the technology. And we are looking at that and to try to create realistic settings, be it like a family room or a small classroom or a meeting room, and study how the impact of technology on disrupting the normal flow of interactions has on these interactions, meetings, classrooms, and so on. So in all of this, we're either looking at people making decisions, people interacting in different social contexts, people interacting with software to achieve a certain purpose or to complete certain tasks. And all of those things are reflected in the healthcare system, which is in dire needs of moving from being paper-based, like face-to-face based, to being more electronically based in certain areas, at least to overcome the huge burden and that comes about from the increasing demand from an aging society that is placed on the healthcare system right now. So we need to make the system more efficient by leveraging information and communication technologies, but we can only achieve this by doing it in the right way. And to do that, we have to have a deep understanding of the needs and concerns of the user in using those technologies and how it impacts the normal workflows and the interactions between them, how to manage the change that will come about when you actually implement those systems in various contexts, like, for example, in a hospital or in a clinic or in even a private facility like a family physician. How does it impact the patient? How does it impact the nurses? How does it impact the physicians? And what kind of ecosystem do we need to have those systems be successful? So for instance, you need to have the right business models to motivate all the parties involved to actually engage in utilizing these technologies, to show them the benefits and also to show them that it will save them time, it will provide additional compensation, or it will reduce errors. So all of those things can come together in order to show the value of the technology in a healthcare setting and move the healthcare system to be a better system for everyone involved.